Meet Your Neighbor is sponsored by Louisiana Gastroenterology Associates.
Welcome back. We are hanging out at Louisiana Gastroenterology, and I'm joined with Dr. Broussard. Thanks for letting us hang out with you guys today.
Thank you for having me.
Of course. We're talking about how our friends at home can essentially test for life when it comes to colon cancer. Let's talk about family history. Why is it so important for an individual to know their family history?
So it's very important to know your family history because this may change our recommendations as far as when and how you need to be screened for colon cancer. So if you have a first degree relative with colon cancer, so that includes anybody who is a sibling, parent, even children, you're actually eligible for colon cancer screening at age 40 instead of age 45. Or you're eligible for screening at 10 years younger than that cancer diagnosis. So for example, if your father was diagnosed with colon cancer at age 43, you should actually start getting screening at age 33.
Okay.
And the recommendation is that we only use colonoscopy in higher risk patients who have a family history of colon cancer.
And you mentioned kind of siblings, father, mother. What about an aunt or an uncle or even a grandfather? When should people consider being tested if one of those relatives has colon cancer?
So these are important to know as well, especially if you have multiple family members who've been diagnosed with a similar cancer, whether it be colon cancer, breast cancer, or any other types of cancer. So when we see multiple generations with similar cancers, sometimes that raises the alarm for inherited cancer syndromes, and those are managed a little bit differently from a screening standpoint.
And let's say a family member has a history of polyps. What does that necessarily mean for that individual in terms of colon cancer?
So there are certain patients who may be eligible for that earlier screening, so starting at age 40 or starting even before the age of 40, if they have advanced colon polyps, or if their parents have advanced colon polyps, siblings have advanced colon polyps, and that's considered larger polyps or even polyps that have signs of early cancer. So it's important to ask your family members if they did have polyps, or they considered more aggressive polyps, or that they have signs of cancer cells, because that may change our recommendations on when and how we start screening you as well.
Yeah, it's important to know everybody's history when it comes to polyps, colon cancer, especially in this scenario. Now, what about other types of cancer? What if someone in the family had breast cancer? Does that make you more at risk?
So it can mean that you're at risk. So there are these inherited cancer syndromes that we see, which include things like Lynch syndrome. So it's important, especially when you have a family member who's diagnosed with any cancer at an early age, because those family members probably underwent genetic testing. And if they were positive for one of these syndromes, you may be eligible for genetic testing as well. And if you turn out to be positive for one of these syndromes, then your screening recommendations may change based off of those.
And I know you just mentioned Lynch, but there's another one, Gardner syndrome. They're related to genetics and colon cancer. Can you explain that for our friends at home that are watching?
Correct. So these are inherited genetic syndromes in which patients are at increased risk for developing colorectal cancer, as well as other types of cancer. So with Lynch syndrome, patients are most at risk for getting colorectal cancer and endometrial cancer. They are also at risk for getting other types of cancer like stomach cancer or cancer of the urinary tract. So it's important, if you have a family member that has Lynch syndrome, these first degree relatives, you should undergo genetic testing as well to see if you have that same genetic mutation, because your screening recommendations will change. You actually need to start screening at an earlier age, and then you need to be monitored more frequently to make sure that you don't develop any of these types of cancers.
Yeah.
So, and then for Gardner syndrome as well, this is what we call a polyposis syndrome. So patients are at increased risk for developing multiple colon polyps, and then their risk of colon cancer subsequently goes up. So it's a similar scenario where we have to start colonoscopy at an earlier age, and then we also have to monitor more frequently just to make sure that those patients don't develop colon cancer.
This is great information. Thank you so much for sharing your knowledge with us today. If our friends at home have any questions, especially about some of those screenings, how can they contact you guys here at the center?
So you can contact us via call, you can go, or via the phone, you can go to the website. I'd also encourage you to discuss these things with your primary care provider. And if they have any additional questions, they can always send you to our clinic so that we can answer those questions and determine if you need to be screened at an earlier age.
Thank you so much for hanging out with us today. If you guys at home have any further questions, everything you need to know is right there on your screen. We'll be right back after this.